Yeah, thank you very much. Can you please help us to wake up after lunch? So, let me start by stories. Two quotes, which I had last week. One, I am quoting my deputy who just came back from South Punjab. She wrote to me in her briefing the following. She has visited the flood-affected areas in South Punjab, and she wrote to me, during my visit, I observed that women aged 30 to 32 already have 8 to 10 children due to repeated pregnancies and lack of access of maternal health services. These families are currently living without shelter, on the ground, and suffering from a lack of food and water, with high exposure to communicable diseases. Additionally, there is a profound lack of awareness regarding available family planning services. The practice of monsoon marriages, where girls 13 to 15 are given for marriage as a sort of coping strategy. Quoting end. The second quote, it's at the high level now. It was during the briefing between the United Nations member states, representatives, and the EU delegation who visited Pakistan last week. In the briefing, it has been said by United Nations representatives, when it comes to local and global statistics, we have two Pakistans. The first is showing the recovery and even improvement through the lens of macroeconomic stability, while the second speaks to the social indicators where it is stagnated or even declining. And here, I can see this summit is extremely timely and important to address, amid the changes globally on reduction of ODA. So we should expect that funding is going to go less and less. And second, a shift of global initiatives where it might risk the social agenda in Pakistan. Because the discussion at the last global summit, social summit, was about low fertility, aging, second dividend, but not family planning, not rapid growth of population, not fertility rates. So the big question that we have beforehand in this session is, do we know what should be done? Or do we know how it should be done? Or do we know why it should be done? In my opinion, this is the core question. And let's agree that population agenda is in the first place a political agenda. It could not be left to health departments nor population departments. It's a political agenda. And if it is not driven by political leadership, we should not expect much to happen. Now, assuming that we know what should be done, and assuming that we agree why it should be done, this session will try on the how part, how it could be done. And we will try to learn from the regional expertise. Let us look at the landscape today. What do we have before us. In the last few years, Pakistan macroeconomic indicators has improved. It is back now to moderate GDP growth, reduced inflations. However, this economic stabilization did not reflect itself on the social agenda and the social development, where Pakistan is still at the lowest position when it comes to gender inequality index. Fertility is still very high. Population growth is high. Maternal health services are still weak. And there is a fragmentation in the support. So, what we can do and how other countries have addressed this matter. From my observation, after 3 years being in Pakistan, I could notice that the challenge in Pakistan, in the first place, is a governance issue. It is a governance issue that speaks to lack of accountability, fragmentation, lack of political support, lack of coherence. If somebody can tell me what is Pakistan vision concerning population, if I ask this question to Professor Ahsan Iqbal, I will get an answer. But if I go to the Chief Minister of Punjab, for example, I might get different answer. If I go to KP, I might have a third answer. So there is still, we don't have a vision what Pakistan is trying to achieve on this agenda, apart from blaming people for being victims. We have too many people. It's a matter of fact. But the number of people is not the whole problem. The main challenge is in the human capital, education system, the outcome of education, the outcome of health system. All these are real challenges that Pakistan is facing. If we look at Bangladesh, we could see that civil society have a massive role in the outreach. The outreach here is very fragmented. If you look at Iran, they have very coherent, strong primary health care. Primary health care here is, again, when it comes to family planning, it's scattered. If you look at Turkey, they have the hospital-based, but they are very much accessible. Accessibility here is an important challenge, and quality of services in the health facilities is another challenge. If you look at Egypt, Egypt is doing a massive outreach campaign when it comes to media. Here, it's very modest speaking about things. So I think there are lessons to be learned from the region, and I am very happy to have a very distinguished panelists who are going to be with us in this conversation. Let me start with the keynote speech by Dr. Rashid Amjad, who's going to go to drive us through the regional perspective and how Pakistan could learn from these experiences. Dr. Rashid, over to you.